Hi, this is Dr. Mitchell Kleonsky, and I'd like to introduce you to the iPad version of the Memory Orientation Screening Test, or as we call it, the MOST. The MOST is a 29-point test which is capable of giving us very high degrees of accuracy in terms of a patient's cognitive level, which will lead us to understanding what next to do in their treatment. The MOST takes less than 5 minutes to administer and score, and in the case of the iPad version is going to yield a report that you're going to be able to integrate into the patient's file. So let me tell you a little bit about this in different sections that you can click on as we go along. The first place you're going to see when you open the iPad MOST is a starter screen that allows you to either start the test, learn a little bit about administrative tips, or learn more about dementia and the authors. Start the test. So we press the button to start the test, and we come up with our demographics section. This allows us to put in a patient name or medical record identifier. I'm going to put in just some different numbers here to serve as a medical record number. I'm going to also ask my testing assistant, Julie, to play the part of an elderly woman and give me her date of birth.
4/1/1930.
Okay, so we're going to put in April 1st, 1930 by spinning the wheel here at the bottom. And as you see, this is going to tell us the age is 82. I'm going to put in female, and we have a choice of education. I'm putting in 15 years or less, and that's all we do to enter the demographics. The first part of the MOST is three-word registration. Here we have a choice of 3 different columns where you're going to select a word from each column and lock it in as you give the instruction to the patient. So I'll say to Julie, I want to do a test of your memory. I'm going to say 3 words to you, and I want you to say them back to me so I'm sure you've heard them correctly. Here are the words: yellow, paper, nickel. Now, say them back to me.
Yellow, paper, nickel.
And I'll ask you to tell me what they are in just a moment.
Okay.
After registering 3 words, we're going to ask Julie what today's date is, because orientation is an important feature of cognition. You'll see at the top that we've locked in what today's actual date is, along with the season and the time, with a half an hour on either direction, so that you're able to easily see what's an acceptable answer. Julie, what's today's date?
May 9th, 2012.
So I put in the month, I put in the date. Now today's actually the 10th, so I'm going to mark that as wrong. The year is 2012. What season is it?
Spring.
What day of the week is it?
Thursday.
And what's the current time?
11:50.
Okay. So that's how we do orientation. After scoring orientation, we're going to move to the clock drawing task. So I turn this around facing the patient, and I allow the patient to use either her finger or a stylus. Now, I'd like you to put in all of the numbers that would appear on the face of a clock. So just place them where you think they should go. I'll also tell the patient that she needs to keep her hand off of the screen while drawing, because that will block the ability of the stylus to register. You're also going to notice up in the right corner we have 2 symbols. One of them is for a pencil, the other is for an eraser. Let's suppose she wants to change one of her answers. Why don't you click on eraser? Now get rid of something that you want to change. Now go back to the pencil and write in what you think should be there. Okay, great. Now show a time of 1:45. You'll notice I do not ask her to use hands to point them to the time of 1:45 because I want her to come up with that on her own. After completing the clock, we're going to move to the next part of the test, which is the recall of those 3 words which we locked in before. So Julie, what were the 3 words I asked you to remember?
Yellow, nickel,
And you can't remember the 3rd one, so I'll mark that as wrong. The next part of our test is a sequence memory section. Now, she doesn't know that this is actually a memory test. What I'm going to ask Julie to do is to name each of the pictures I'm going to show her. So Julie, here's some pictures of things you could find around the house. What do you call that?
basket,
What's that?
tub,
Mm-hmm.
cup and saucer,
I'm going to move these at about 1 every 3 seconds.
lamp, brush, refrigerator, broom,
Now, if she told me it's something you sweep with, I would tell her, yes it is, it's called a broom.
couch,
I'll accept sofa, divan, almost any word that works for the patient is fine as long as it actually represents the object.
teapot, table, stove, telephone.
Okay, very good. Now, after she names all of the items, I turn the iPad back to myself because we're going to the memory section. Julie, I just showed you a variety of pictures of objects around the house. Now I want to see how many you can remember in any order.
Okay. Teapot, broom, refrigerator, stove,
Now, I press each one to lock it in. If it turns out that I pressed the wrong thing, I simply have to undo it, and I can lock it back in again. And that's all there is to scoring this. Now I'm going to score the clock face through 8 specific steps. The first question is, are all the numbers present? As you see, they are. Are they in the correct order? And I'll look at that, and they are in fact. Are they spaced adequately? Are the 12, 3, 6, and 9 within each of these boxes? And making sure that none of the numbers takes the place of a different number. She passes that. Are they inside the face within this gray area? And are they faced toward me rather than toward the center of the clock? And they are. Are there 2 hands? Yes, there are. Do they meet inside this gray area in the center? They do. Is the minute hand longer than the hour hand? Now, she has made one of the most common mistakes of someone who is taking this test, which is she's reversed or equalized the length of the hands. That's a failure. And do the hands point to the 1 and the 9? In this case, they do. So let's score this test. The first choice we have is between scoring this test individually or scoring it against a previous MOST or MMSE. Now, if you have given the person a mini mental state exam in the past, you can enter that score right here, which is going to allow us to compare it with that score because we've created a statistical walkover that modifies the old MMSE into a MOST equivalent. So I just press OK, and now it yields our report. When you get the report, you're going to see that it gives you the information regarding the current score, in this case 18, and its comparison with the previous mini-mental corrected as a MOST equivalent, which is also an 18. Our report tells us that a change in cognition has not occurred since the last time this person was tested. The second thing we're going to see here is a conclusion that at this score, this patient has achieved a score in the range of mild dementia. Following that is a series of care considerations or recommendations that you can employ in treating this patient. Now, while you may be a primary care doctor who does not see a lot of patients with cognitive impairment, we have seen a lot of patients with cognitive impairment and have tried to place on this list of recommendations the kinds of things that you might consider in best treating this patient. Once you've scored and printed the report for the MOST, we're going to send it as a PDF into an email address. So the email successfully sent, you're going to be able to attach this to a medical record or print it out for placement in the patient's chart. And that's it. You've completed the MOST, and it's on its way.